name because whoever was tested positive gave it to me. And I said, okay, well, I just have a question for you. And he's like, yeah, how can I help? And I said, I'm hearing that a lot of the spike in the COVID cases has to do with these phone calls where basically if somebody is being traced like I was, if I were to report and say, hey, I have, a runny nose and a little bit of a cough, that would actually be a positive. Like that would count towards a COVID-19 positive statistic. And I said, is that correct? And he said, yes, that is correct. And I said, that's freaking crazy. Are you kidding me? Like, how can you test or how can you say that I'm positive just based on a runny nose and a cough? Like, that could be freaking allergies. That could be cold. And this kid's just doing this job. Like, I'm not getting mad at him. I'm just frustrated with this whole situation. And he said, we can count you as a positive COVID-19 case if you have positive symptoms, and we don't require a test in order to count you as COVID-19 positive because of, it was this really long freaking planned out phrase, because of the epidemiological risk factor of COVID or something like that. And I was like, okay, so if I come in contact, or if I were to, like, one of my staff members has taken out stitches of multiple HIV positive patients. If she took out stitches for a positive HIV patient, does that mean that she is potentially positive? Anyway, so the point that I'm trying to make is I don't believe these stats. I don't think that it's accurate. I know that we've got a mandatory mask mandate. My question is, to what extent? And I'm not really looking for people to argue one way or another. I'm just sharing my experience, sharing that if I were to have reported that I had a little bit of a runny nose and a cough, which could easily happen with some allergies, or if I was doing construction up in my attic, I could have easily those symptoms, that would have been a COVID-19 positive test. It's freaking madness. And so, I mean, do what you want, think what you want, but just know, like, this is my personal experience. So if you know me, I'm not messing with you. Like, this is the exact thing that happened today. It was kind of crazy too, because when I was talking to him, when he said, yes, that would be counted as a COVID-19 positive test, immediately I put him on the speakerphone and I went up to the front desk where three of the girls were working up front, and they just sat there listening, and I basically asked them the same question so that he would repeat it again. Same questions, and their jaws just dropped, like, what the heck? This is unreal. So there's something at play. There's something going on. I know that there are reports of tests being sent in where a patient hasn't even been swabbed. One of my buddies out in Montana has patients where the patients are nurses, and they got the COVID-19 test, they didn't swab anybody, sent it in, got it back, and those were positive. And so I know that we're seeing those pop up all over the place. So that was my experience. I think it's pretty crazy, and honestly, most times I don't really post anything about this stuff. I try to avoid it because it's so emotionally driven, but I look at the stats, look at the science, and look at the data, and it's freaking crazy, guys.